All right, my apologies. I will get back to hopefully where I was at. Give me one sec. All right. So again, the humerus is an important bone that you're going to need to know. I guess I won't go into the larger screen. Okay, so at the proximal end of the humerus is the humeral head. The humeral head articulates with the glenoid fossa, creating the glenohumeral joint. There are two tubercles which are important landmarks for muscle attachments, which we will go over. The greater tubercle and the lesser tubercle. Greater tubercle is superior, the lesser tubercle is more on the anterior side. Between the two tubercles is known as the intertubercular sulcus. You will also know it as the bicipital groove. The bicipital groove. I will call it the bicipital groove more. But between, tubercular, the tubercles, groove. It's a space. Okay. In that space is the long head of the biceps and also some muscles, which we will go over. In the middle upper portion is the deltoid tuberosity. That is where the insertion of the deltoid muscles are. On the distal end of the humerus, we have the structures for the elbow. So we have the capitulum. The capitulum, which is on the lateral side of the humerus, articulates with the radius bone. The trochlea, which is medial, attaches to the ulnar bone. Those two parts are on the anterior portion of the humerus. Right above that area, we have the medial and lateral epicondyles, where we have many muscles coming off it. Remember, the medial epicondyle, we have the flexors of the wrist and forearm and fingers, and off of the lateral epicondyle, we have many of the extensors. Right above the epicondyles, we have the medial and lateral supracondylar ridges. Again, supracondyles, above the condyles. And in that area, we have these rough spots, these ridges, where we have muscle attachments. On the posterior portion of the bone, we have the olecranon fossa, where the olecranon process of the ulna articulates with. And finally, again, going back onto the front, above the capitulum, we have the radial fossa. Again, that's where the radius will articulate with. And above the trochlea on the anterior side, we have the coronoid fossa. So those are the landmarks that you're going to need to know. All right, so let's talk about the muscles. In that bicipital groove, all right, we do have the long head of the biceps that go through there. But the long head of the biceps brachii goes through the bicipital groove. Remember also the latissimus dorsi has an insertion in there, as does the pectoralis major. So within the bicipital groove, we have latissimus and we have pec major. Coming off of the coronoid process is the flexor digitorum superficialis. All right, coming off of the coronoid process, remember that's medial. All right, we have the flexor digitorum superficialis. Remember that muscle does not go to the DIP. It does not flex here. It's flexor digitorum profundus that goes all the way to the DIP. Superficialis goes to the PIP. At the deltoid tuberosity, nice and easy, is the insertion of the deltoid muscle. Okay. Femur, fibula. At the greater tubercle, all right, the greater tubercle, which is on the humerus, we have 3 of the rotator cuff muscles, 3 of them. At the greater tubercle, we have most superiorly supraspinatus, in the middle infraspinatus, most lateral teres minor. From the greater tubercle, infraspinatus, supraspinatus, and teres minor. On the humeral shaft, on the bone itself, we have the brachialis muscle, which is on the distal side, and the coracobrachialis, which is more proximal. Remember, the coracobrachialis has its origin on the coracoid process. Okay, we have, let's see what we got here. Now going down distally, we have the lateral epicondyle. Remember, the muscles coming from the lateral epicondyle are usually, this is known as the common extensor tendon from the lateral epicondyle. So here is a list of some of the muscles that come from this area. Anconeus, remember, it's that small muscle that helps with elbow extension. It works with the triceps brachii. Extensor carpi radialis longus. Extensor carpi ulnaris. Extensor digiti minimi. Extensor digitorum. So again, also extensor carpi radialis brevis. As you can see, common extensor tendon is the lateral epicondyle. The supinator muscle has its origin on the lateral epicondyle. At the lateral supracondylar ridge, again, which is above the epicondyle, brachioradialis has its origin there. And extensor carpi radialis longus and brevis also come from there. The lesser tubercle, remember our greater tubercle had 3, had supraspinatus, infraspinatus, and teres minor. Well, at the lesser tubercle has the 4th rotator cuff muscle, subscapularis, coming from the anterior side of the scapula. Also on the lesser tubercle, like I said earlier, is the teres major, coming from the lateral border. It goes around and inserts onto the lesser tubercle. So we spoke about the lateral epicondyle being the common extensor tendon. Well, the medial epicondyle is the common flexor tendon. Flexor carpi radialis. Flexor carpi ulnaris. Flexor digitorum superficialis. Palmaris longus. And pronator teres. Those muscles, also flexor digitorum profundus, also has a part on the medial epicondyle. Remember, it is profundus that flexes the DIP. Superficialis only goes to the PIP. All right, metatarsals. Okay. All right. Almost done. All right. Okay. So that's the humerus. A lot of muscles on the humerus. All right, come on. Wants to advance here. All right, the radius bone. The radius bone, again, is the thumb side bone. The head of the radius is proximal. The head of the radius has a small hole in it known as a fovea. The head articulates with the capitulum of the humerus. On the radius bone, there is also the radial tuberosity, which is the insertion for the biceps. There's also a styloid process at the distal end of the radius. Remember, it is the radius bone that moves for supination and pronation. Remember, when your arm is in the anatomic position, you are supinated. The radius and the ulnar are parallel to each other. When we pronate, it's the radius that moves and creates that X shape. Okay? It's the radius that moves that creates that X shape. So let me go to the radius bone here. There are some muscles here. All right. So again, the radial tuberosity, projection, that's the insertion point for the biceps brachii. The radius bone has some muscles on it. Extensor pollicis brevis, an extensor of the thumb. Flexor pollicis longus, a flexor of the thumb. Remember pollicis. Pronator quadratus. The pronator quadratus muscle is at the distal end and it does pronation. Pronator teres, which is more at the proximal end, and the supinator bone muscle, I'm sorry. The ulnar bone, remember on the top here, on the distal end, we have that trochlear notch. Looks like an opening of the mouth. All right. But you have to know all the parts of that area. The olecranon is the bony point at the top. The coronoid process is the bony point at the bottom. And in between the olecranon and the coronoid is the trochlear notch. Going down the ulnar, this bone too has a styloid process. Now there is a membrane that connects the two, known as the interosseous membrane. It helps attach the radius and the ulnar, but it has a more important job of dissipating forces. All right, it helps dissipate forces within the bone, within the two bones itself. Now, the ulnar bone also has many muscles that attach to it. The ulna has extensor carpi ulnaris, extensor indicis, extensor pollicis longus, flexor carpi ulnaris, flexor digitorum profundus, and the pronator quadratus. Has many muscles that attach to it. So a lot of muscles attached to these bones here. The carpal bones, you need to know the carpal bones in their correct rows. So the proximal row, the row closest to the radius and the ulna. From the thumb side, we have scaphoid, lunate, triquetrum, and pisiform. Remember, pisiform is that special bone known as a sesamoid bone. It is within the flexor carpi ulnaris muscle. The distal row of carpals is the row of carpals closest to the fingertips. From the thumb side, it is trapezium, trapezoid, capitate, and hamate. That is how you're going to need to know those bones. And yes, the carpal bones are on the practical. I repeat, the carpal bones are on your practical. You will need to know those 8 bones. The metacarpals and the phalanges. The metacarpals are the long bones between the carpals and the phalanges. Okay, and the phalanges are made up of these small finger parts here. We have different joints. We have the carpal metacarpal joint between the carpals and the long metacarpals. We have the metacarpal phalanges joint, which the MCP, which is the knuckles. Above the MCP is the PIP, or the proximal interphalangeal joint. And above that, we have the DIP, known as the distal interphalangeal joint. Now, the fingers has a great deal of muscles that attach. So let's go through the hand. So at the radial styloid process of the radius, the brachioradialis has its insertion. It comes from the lateral supracondylar ridge. At the phalanges on the hand, we have extensor digitorum, flexor digitorum profundus, and superficialis. Remember, superficialis goes to the PIP, profundus goes to the DIP. Also at the phalanges, we have extensor indices and extensor digiti minimi. All right. I know there's more of the hand muscles. Give me a second here. All right. So being more specific, at the first metacarpal, we have abductor pollicis brevis, extensor pollicis brevis and longus, and flexor pollicis longus. That's at the first metacarpal. At the second metacarpal, we have extensor carpi radialis longus. Guys, I know you're not going to be able to know all these right off the bat. When you start going through the muscles, then come back to the video and it'll give you an idea of where these muscles are at. So at the second metacarpal, extensor carpi radialis longus, extensor indices, remember, extends the index finger, and flexor carpi radialis. At the third metacarpal, we have extensor carpi radialis brevis, and at the fifth metacarpal, we have extensor digiti minimi and flexor carpi ulnaris. Remember, flexor carpi ulnaris, that's the muscle that the pisiform sits in as a sesamoid bone. Let's see here. On the olecranon process of the ulnar, we have the anconeus and the triceps brachii. Okay. All right. Okay. And that should pretty much be the hand. Almost done. So again, here's the sesamoid bone of the hand, the pisiform that's within the pisiform, remember, is on the proximal row closest to the radius and the ulna, and the pisiform is within the flexor carpi ulnaris muscle. So the pelvic girdle, you're going to need to know about the sacroiliac joint, the pubic symphysis. I'm not worried about the false or true pelvises. You will need to know this hip bone. You're going to need to know the 3 parts of the hip bone. So first, what we have on the top is the iliac crest. All right, the iliac crest is on the top here. Okay, so here, right here is the iliac crest. Right here is the acetabulum, where the femur, the head of the femur articulates. And right here, this hole is known as the obturator foramen. All right, that's where the piriformis muscle comes through and sometimes sits on that sciatic nerve. So in tan is the ilium portion. In green is the ischium portion. And in pink and purple is the pubic portion. So some of the parts that you're going to need to know. On the ilium, you're going to need to know the iliac crest. You're also going to need to know the anterior superior iliac spine, the ASIS, and the AIIS. On the posterior side, you're going to need to know the posterior superior iliac spine and the posterior inferior iliac spine. On the posterior portion of the ilium, there is a greater sciatic notch. All right, it's a large notch. The ischium portion, the most important part of the ischium, is the ischial tuberosity. All right, that's the area where you sit. And on the pubis, I'm going to need you to know the body of the pubis where the pubic symphysis will be lying. Now, there are a lot of muscles that come from this area. A lot of muscles that come from this area. So let's talk about some of them. From the ilium. From the ilium, remember all the glute muscles. Remember, glute max comes from the crest. Glute medius is just below the crest, and glute minimus is below the medius. So all the glutes, max, medius, and minimus, have origins on the ilium. The latissimus dorsi comes from the ilium, and also the lower 4 ribs, and also the sacrum. And finally, the quadratus lumborum, the hip hiker muscle, comes from there. The ischial tuberosity. So the ischial tuberosity has all of the hamstring muscles, semimembranosus, semitendinosus, and biceps femoris. All 3 of those muscles have origins at the ischial tuberosity. The adductor magnus also comes from that area too. All right, those are femoral muscles. Foot, tibia. Now, the AIIS, has the rectus femoris coming from that muscle, from that bone, and the sartorius comes from the ASIS. So again, the ASIS is the sartorius muscle. The AIIS is the rectus femoris muscle. All right. At the iliac crest, we have the internal and external oblique. We have the tentor fascia lata and the transverse abdominis. Latissimus comes from there. Quadratus lumborum, and the gluteus maximus. Remember, glute max comes from the iliac crest. Medius and minimus do not. From the iliac fossa itself, the iliopsoas comes from that area. Also, the gluteus medius and minimus come from that area. All right. So from the iliac fossa. Remember, medius is just below the crest, and minimus is below the medius. The iliotibial band has the gluteus maximus muscle and the tensor fascia lata muscle. Okay. From the pubis area, from the pubis, we have adductor brevis and adductor longus. We have gracilis, pectineus, and the rectus abdominis muscle. Okay. So those are the muscles that come off the hip bone. A lot of muscles come off of that hip bone. Okay. This is just a comparison of the male and female hip and the pelvic opening. The male is heavier and thicker, but the female is wider to allow for pregnancy. And remember, what happens, a woman's hormones, certain hormones will actually soften up the area and soften up the cartilages, like the pubic symphysis, to allow for the head of the baby to come through successfully. So at the lower limb, we have 4 regions. The femoral region goes from the hip to the knee. The crural region is basically the back of the knee. The tarsal region is the ankle. And the pedal region, pedal, like you're stepping on the pedal, is the foot itself. All right, the femur. Let me raise this up a little bit. I don't know why it's so small. The femur, largest and strongest bone of the body. The femoral head, you've got to know, it articulates with the acetabulum of the pelvis. It is a ball and socket joint. Within the femoral head, there is another small pit. It is known as the fovea. It allows for a connection between the femur and the acetabulum by a ligament. There is a greater and lesser trochanter. In between the trochanters is something known as the intertrochanteric crest, between trochanters. On the posterior portion of the femur is the linea aspera. It's a ridge on the posterior portion of the femur. On the bottom, on the distal portion of the femur, there are medial and lateral condyles. On the bottom, that is this off-color area of the bone, and right above the condyles are medial and lateral epicondyles. Between the condyles is an intercondylar ridge, and on the front side there is a patella surface to allow for the patella to move smoothly. Now, the muscles of the femur. Coming off of the lesser trochanter is the iliopsoas. Remember, the iliopsoas is the strongest hip flexor in the body. All right. Okay. Tibia, tibia, tibia. All right. Here's the femur. All right, so coming off of the femur is 3 of the adductors: adductor brevis, adductor longus, and adductor magnus. We have pectineus, which is one of the lateral rotators. We have plantaris, which is that long muscle with the long tendon. And all of the vastus muscles, vastus lateralis, medialis, and intermedius, all come from the femur. Remember, rectus femoris has its origin at the AIIS. At the greater trochanter of the femur, we have gluteus medius, gluteus minimus, and gluteus max. All the glute muscles attached to the greater trochanter. The piriformis, one of the lateral rotators that you must know, the lateral rotator you must know, comes and attaches, has its insertion on the greater trochanter itself. On the femoral condyles, all right, on the femoral condyles, we have the gastrocnemius. Remember, that's the 2-joint muscle in the posterior portion of the calf. And the popliteus. Remember, the popliteus muscle is the muscle that unlocks the extended knee. It unlocks an extended knee. It's the key to unlocking the knee. That muscle doesn't work, we're stuck in extension. Not a good thing. The patella, also known as the kneecap, it is the other sesamoid bone with the pisiform. All right. You have to know the parts of the patella. The top part, the broad superior portion, is known as the base. Now, guys, I know this is weird sounding, all right, because base is bottom, but the base on the patella is this area here. This is the base right here. The apex is the pointed inferior part. This is the apex down here. This is the base up here. Okay. Again, this is a sesamoid bone. The quadriceps tendon, the patella ligament, is where the sesamoid, where the patella sits in. Okay. So the quadriceps tendon makes the patella a sesamoid bone. You must know, you need to know what it looks like for your practical, but for your exams, you're going to need to know the top portion is known as the base. It's bigger. The apex is the bottom inferior portion, and it is pointed. The tibia. All right, we're getting close to the end, guys. Getting close to the end. There's about another 7 or 8 more. The tibia is a thick, weight-bearing bone. You're going to need to know the parts of the tibia. On the top, on the proximal side, you have the medial and lateral condyles. The medial and lateral condyles of the tibia articulate with the condyles of the femur. The condyles of the femur and the condyles of the tibia articulate with each other. In between the condyles of the tibia is something known as the intercondylar eminence. It's a ridge that separates the condyles. It looks like a mountain range. Okay? Again, between, condylar, in between the condyles. Eminence means large. The tibial tuberosity is in the anterior portion, anterior proximal, right in the middle. All right. And the tibial tuberosity is the attachment for the quadricep muscle. The tibia at the distal end is the end point for the medial malleolus, the medial ankle bone. So the tibia creates the medial malleolus, the fibula creates the lateral malleolus. One other section here, the anterior proximal medial portion of the tibia. Remember, we spoke about that. That section is known as the pes anserine. The pes anserine. Let me point it out to you. It's not on this picture. All right. Here, so here's the fibula right here. We know that's lateral. Right here is the tibial tuberosity. Right here, where I'm creating this X, that is the area for the pes anserine. It's medial, it's anterior, and it's proximal. See, here's the proximal side, and here's the distal side. As you can see, here's the medial malleolus. The tibia creates the medial malleolus. The pes anserine is the proximal anterior medial portion of the tibia. And there are three muscles that have its insertion right there, and we're going to go over it. Do the fibula next. So the muscles that come from the tibia, extensor digitorum longus, flexor digitorum longus, the extensors and flexors that go to the toes, popliteus, all right, the muscle that unlocks the knee, soleus. Soleus is one of the calf muscles. It is the deeper calf muscle underneath gastroc that plantar flexes the ankle. Tibialis anterior, that dorsiflexes the ankle, and tibialis posterior. On the tibial condyle, the semimembranosus attaches to there. Semimembranosus attaches to the tibial condyle. At the tibial tuberosity, we have the quadriceps group. All right, the quadriceps group attaches at the tibial tuberosity. The rectus femoris and all of the vastus. Vastus lateralis, vastus intermedius, and vastus medialis. At the pes anserine, remember the area that is proximal anterior medial tibia. It's right next to the tibial tuberosity. There are three muscles that attach to the pes anserine, and you've got to know them. Gracilis, sartorius, and semitendinosus. Those are the three muscles that attach to the pes anserine. Right? The fibula is the lateral strut bone that's on the lateral side that articulates with the tibia. The fibula is a slender bone that stabilizes the ankle. At the proximal end is the head of the fibula. There is a point at that end of the fibula. At the distal end is the lateral malleolus. So the distal end of the fibula is the lateral malleolus. Let me get to the fibula bone. There are many muscles that attach to the fibula. Some of the muscles that attach there, biceps femoris has its insertion on the fibula. Remember, its origin is on the ischial tuberosity with the other hamstrings like semimembranosus and semitendinosus. Extensor hallucis longus, fibularis brevis. That's why I don't want you to call it peroneal. Fibularis is going to tell you that it's coming from the fibula. Fibularis brevis, fibularis longus, fibularis tertius. Those are the muscles that come from the fibula. And finally, the flexor hallucis longus also comes from the fibula itself. Now remember, at the distal end, we have the ankle bones. The tibia correlates to the medial malleolus, and the fibula correlates to the lateral malleolus. The ankle and the foot bones, on the top here, the most superior bone is the talus. It's the talus that articulates with the medial and lateral malleolus and allows for dorsiflexion and plantar flexion. Underneath the talus is the calcaneus. That's where the gastroc and soleus connect to the Achilles tendon, and the calcaneus is the attachment point for that bone, for that muscle, for that tendon, actually. In between the talus and the calcaneus is a small bone, which is located on the medial side. It is known as the sustentaculum talus. That bone helps stabilize the talus on the calcaneus. We'll go over that bone when you guys get into school. Right after that, on the medial side, we have the navicular. It looks like a square bone, but it's not really square, but it protrudes medially to where you can actually palpate it yourself on your own foot. And the part that you're palpating is known as the navicular tuberosity. Right above the navicular, you have the cuneiforms. You have the medial, the intermediate, and the lateral cuneiforms. Those three bones come across, and then there's a fourth bone known as the cuboid bone. And the cuboid bone definitely looks like a cube. Connecting to the cuneiforms and the cuboid are the metatarsals. The metatarsals are the long bones of the foot. Okay? The long bones of the foot. And finally, you have the phalanges of the foot, just like in the fingers. Okay? So we're not going to worry about too much of that. All right? And we're good with that. Okay. Stop the share. All right. So that, again, so we kind of reviewed all the bones again, but this time we added the important muscles that attach to these bones. Okay, so tomorrow, what we're going to do, and tomorrow probably won't be as long, next 2 days will not be as long. Tomorrow, we will talk about the innervations, the nerve innervations of these muscles, and we're going to try to group them to try to make things a little bit easier study-wise for you. All right, so tomorrow is innervations. On Thursday, we will group the muscles in their movements, and what movements they perform. So hopefully that will also make things a bit easier in your studying of the muscles. All right, we will see you tomorrow. You guys have a wonderful, wonderful evening. and ciao.